Good afternoon and welcome everyone. My name is Jim Rooney. I'm the President and CEO of the Greater Boston Chamber of Commerce, and we are very excited for this forum today as it is the really first of its kind in a chamber series and is being held in collaboration with the Hunger to Health Collaboratory and Stop and Shop. The title of today's event is The Economic and Health Impacts of Food Insecurity. The business community is change maker, and I'm sure all of us have in some ways witnessed the growth in the issue of food insecurity. I personally live near two food banks, and one particular very near to my house. You can see the change. You can see the lines are a little bit longer, and you can see people that you wouldn't have expected to be in such lines that are now experiencing some measure of food insecurity, and it certainly affects all of us in society, including the business community. And I know that our panel today will have some good discussion about that issue. Before we get started, a few reminders. I'd like to flag that today's event is being recorded. I'd also like to remind attendees to utilize the chat and Q&A feature. We will get to as many questions as we can during the event. And with that, I'm pleased to welcome the President and CEO of the Greater Boston Food Bank and founder of the Hunger to Health Collaboratory, Catherine D'Amato, who will introduce today's program, and our special guest, Congressman Jim McGovern. Welcome, Catherine, and I'll turn it over to you.
Thank you, Jim. Really appreciate all the hard work to you and your team for pulling this together. It's my distinct honor and pleasure to welcome our invaluable national champion on hunger issues, Representative James McGovern from Massachusetts 2nd District. He was elected to the House in 1996 and appointed to the House Rules Committee in 2001, named ranking member in 2018, and became chairman in 2019. One of Congressman McGovern's greatest passions was to establish the Hunger Caucus. And in doing so, he continues to be such an advocate and tirelessly for funding programs that help working families and children and access to food for the elderly and all those who need it. You know, he has authored the McGovern-Dole International Food for Education and Child Nutrition Program to provide school-based meals to millions of children in some of the world's poorest country. He is our true champion, and I am so pleased to introduce him to you today, Representative Jim McGovern.
Well, thank you, Catherine, my dear friend, for the kind introduction, and I appreciate your advocacy and the incredible work that is done at the Greater Boston Food Bank to help people make ends meet. We have a hunger problem in this country, and we have a hunger problem in Massachusetts, but it is being alleviated in large part by the incredible work of the food bank. And again, I can't say enough nice things about Catherine. So good afternoon, everybody. I'm very pleased to be here and welcome you to today's very important conversation. Before the pandemic, some 40 million Americans lacked the resources to keep food on the table, and the ravages of COVID-19 have only compounded the challenges and disparities of food insecurity for workers and their families, our healthcare system, and our regional, national, and global economies. And in the wake of the pandemic, Congress has acted, and we've made some incredible investments in our anti-hunger safety net. We've seen new private-public partnerships formed to help deliver food to people in need. Improvements we've made to the child tax credit have dramatically reduced childhood hunger in this country, and we are now trying to make the child tax credit permanent. But what's clear to me is that we can't stop there. We can't go back to normal. When people say, I can't wait to go back to normal, I say normal wasn't good enough. We need a holistic plan to finally end hunger in this country once and for all. I've been in Congress a long time. I've cared deeply about this issue. But the one thing I've learned is that there's not one committee responsible for dealing with hunger. There's not one agency that is responsible on the executive side to deal with ending hunger. It falls under multiple jurisdictions. And as a result, a holistic plan has not been developed. Hillary Clinton famously said it takes a village. I say it takes a plan. You need a plan for the village to implement, and that's what we desperately need. So that's why I'm calling on President Biden to host a White House conference on food, nutrition, hunger, and health. The conference would bring together all the various agencies from all across the federal government, all the relevant congressional committees, as well as researchers and advocates, private industry, and people with lived experiences to develop a roadmap to end hunger by the year 2030. You know, we had the first and only White House conference on this topic back in 1969. That's 52 years ago. And that led to improvements in our federal food assistance programs. It expanded and improved the food stamp program, that we now call SNAP. It expanded and improved the school lunch program and led to the establishment of WIC, the Women's, Infants, and Children's Program. These investments in the 1970s dramatically reduced hunger and poverty in the United States. And I believe we can do that again. So I'm thrilled to participate at the opening here in today's discussion, which brings together leaders in the business community for a discussion on the economic and health impacts of food insecurity. You know, groundbreaking research led by doctors at Boston Medical Center found hunger to cost nearly $180 billion a year in healthcare costs and poor educational outcomes. So it's my hope that a White House conference will help us to think boldly to scale up initiatives like medically tailored meals, for example, or produce prescriptions, and double up bucks to help improve health by alleviating hunger. Because to me, hunger and food insecurity are directly linked to nutrition insecurity. So ending hunger is not only the right thing to do, it benefits our economy and it saves money. So I appreciate the Hunger to Health Collaboratory for bringing together this excellent and timely conversation. The business community has a tremendous role to play in ensuring that our fellow neighbors can put food on their tables. And I look forward to continuing working with the Hunger to Health Collaboratory on seeking longer-term solutions to our food equity and health challenges. Let me just say finally, people ask me, like, why are you into this issue? And my answer is always the same. There is not a congressional district in America that is hunger-free. And I have people coming to my office all the time looking for food. I have two sisters who are school teachers who on Mondays tell me about kids who have come into their classroom who haven't eaten all weekend. I'm ashamed of that. I think all of us should be ashamed of that. Hunger is a political condition when all is said and done. We have the food, we have the resources, we have the knowledge, we have people who want to collaborate. We have everything but the political will. And so with conversations like this, plus this White House conference, I hope we can finally develop the political will to rid this country of this terrible scourge of hunger. So with that, I thank you so much, and I yield back my time.
Thanks, Jim. We just so appreciate your efforts, and you've done so much to make sure that food equity is brought to the United States and around the world. So thank you, and thank you for joining us. We know you're very busy at Capitol Hill. This is an important conversation today, being sponsored by the Chamber and Stop and Shop, along with the Hunger to Health Collaboratory. And while the collaboratory was founded by the food bank here, it mobilizes cross-sector leadership to seek solutions to health inequities resulting from food insecurity. And I'd really like to thank the Chamber for this platform, and to Stop and Shop for being the premier and founding sponsor of the collaboratory. So a lot of gratitude to help us do this work. Today, our panelists are going to focus on three things: their perspectives on some of the health and economic consequences of food insecurity. They're also going to look at how the business community can play a critical role in supporting staff in developing long-term sustainable solutions. And lastly, how cross-sector models like the Hunger to Health Collaboratory can help build better, healthier, and more resilient, equitable communities. I'd like to take now a moment to introduce our esteemed panelists and our moderator. To begin with, Gordon Reid. Gordon, who has had more than 35 years of international retail experience, serves as the president of Stop and Shop, a great local brand of Ahold Delhaize USA, Founded in 1914, Stop and Shop now has more than 400 stores across the Northeast and employs 58,000 associates. Megan Greenfield. Megan is a leader at McKinsey, and she works in the marketing and sells healthcare and private equity practices. A biotech researcher by training, Megan brings an understanding of the technical and business complexities of healthcare to her client work. Next, Prabal, Chakrabarti. Prabal is an executive vice president at the Federal Reserve Bank of Boston and oversees the regional and community outreach work, which works with economic well-being of low-income and moderate-income people. His department focuses on revitalizing smaller cities through the Working Cities Challenge, improving household financial stability for all, especially by race and ethnicity, and finally, increasing employment opportunities by improving the quality of the jobs and enhancing access to quality, affordable childcare. And bringing us through this entire panel is our moderator, Zamawa Arenas. She's a 5-time Emmy Award winner and is a marketing strategist and entrepreneur intent on making a difference. Zamawa is the founder and CEO of Flowetik, a marketing consultancy for social impact enterprises. The firm partners with clients advancing equity and driving change in healthcare, education, and economic development. Thank you all for joining us in the audience. And today we're going to explore what we've learned about COVID-19 and how to move forward to a healthier population and economy. I will now turn it over to you, Zamawa.
Thank you, Catherine, for the introduction. And thank you to the Chamber, the Hunger to Health Collaboratory, and Stop and Shop for convening us today. Welcome, Megan, Gordon, Prabal. It's really good to be with you this afternoon and have this conversation. As Congressman McGovern said in his remarks, COVID-19 has compounded the challenges and disparities of food insecurity, and there is mounting evidence of the human economic costs of food insecurity that affect us all. As someone who faced food insecurity at one point in my life, relying on the cheapest canned food I could afford and making small portions of meals last several days, I really appreciate the opportunity to raise awareness on the issue of food insecurity, which I believe could be a critical problem that to many of us is invisible. In our region, estimates indicate that at least 1 in 10 adults and 1 in 9 children do not know where their next meal will come from. Food insecurity could be affecting our colleagues and our employees, and without it being evident, some may have difficulty providing food for their families for lack of money or lack of other resources. People may be working, but one car repair, a sick child, an unexpected emergency can put them into food insecurity. Food insecurity during the pandemic worsened for some groups. And again, we see inequities in our system exposed through this challenge of the pandemic. According to a recent report by the U.S. Department of Agriculture, in the past year, households with children were twice as likely to experience food insecurity as households without children. Black households were 3 times more likely than white households to be food insecure, and Latinx households were 2.5 times more likely to be food insecure than white households. We also know from a report supported in part by the Collaboratory that food insecurity in Massachusetts increased 55% from 2019 to 2020. That's 55%. That's a really significant increase. Food insecurity is a pressing public health challenge, and we heard the Congressman speak to this and the work that he's doing at the Capitol and in the state. So clearly, this is an issue that requires our urgent attention. So I want to thank the audience, all of you who showed up today, this Friday afternoon, to join us for this important conversation as we continue to explore what we've been learning during COVID-19 and how to move forward to a healthier population and economy. And like Jim said, please use the Q&A function to submit your questions. We will get to them later in the program. And so I want to get us going and get us started. And we will get into the details later. But let's begin with a broader question for each of you. To begin, what are your most pressing concerns related to food insecurity? And Prabal, can you kick us off?
Terrific. Thank you, Zamawa, and thanks to both the Chamber and the Greater Boston Food Bank for this opportunity. What I would say is my most pressing concern is what the Congressman referred to in his talk, which was the rising levels of food insecurity that we saw, particularly here in Massachusetts, prior to the pandemic. So my concern really is that we had structural issues that led to food insecurity in a country that shouldn't have any, should have zero, prior to the pandemic. Now, the pandemic itself, these policies, the pandemic EBT, the child tax credit most recently, the amazing private local response by nonprofits, food banks, the private sector as COVID hit, the schools, the way in which food got out. There's a lot of good there. And you can see in the data that things either stabilized or even improved in some cases when it could have been a disaster. So the question though is, despite these policies, there was people that missed out. So my concern is, how do you catch those that missed out? But the other concern is, how do you put us in a sustainable path for the future, for the long term? That's really my most pressing concern. And I think that the business community and the local community have a strong role to play. I hope we get into.
And we'll get to talking about sustainable solutions long term. But now, Megan, what's your take on this?
Thank you so much for bringing us all together for this critical issue. It's near and dear to my heart. Starting about 10 years when I started getting deeply involved with food insecurity, actually in Chicago, we led a program on 1 million meals for hungry Chicagoans. And it was just really, frankly, terrifying at the level of food insecurity that we see. And like you said, it can be next door and you may not even know. So in terms of pressing concerns, I take the angle from our charitable food system, which has been tested like it never has been before. As you highlighted, right, over a 50% increase in demand in terms of food insecurity, and you can only imagine the impact. If you haven't gone to a food bank and you think it's easy to manage both higher demand as well as an influx of donations, it's really eye-opening, the complexity of those operations, often sort of stitched together with a ton of volunteers, and trying to manage that is really challenging. So as I see for this critical backbone, the challenges they're facing, so demand and supply forecasting so they can actually manage the flow and actually have space to hold the food and manage the food and ensure that it gets through the system. Supply chain resilience, as we saw across, and I'm sure Gordon will talk about that in our entire food system, but that also, of course, hit the food banks. And then how do you just manage operational excellence, just given the amount of volume that you had to manage? I think beyond that, that's sort of the near-term challenge is thinking about how do we enhance the nutritional content, right? It's much easier to have foods that's shelf-stable to go through these systems than the more nutritious non-shelf stable. And then just how do we make sure we keep diversity, equity, and inclusion and ensure that everyone has equal access is going to be critical as we advance the system.
Thank you for that. And we are going to talk about diversity, equity, and issues of disparity. But going back to you, Gordon, I would love to get your perspective from the business community and also this point that we're talking about in terms of supply and demand.
Sure. No, I think, obviously COVID has raised awareness of food insecurity, but as the Congressman said, food insecurity has been around for a number of years and is a serious issue in society. And you look at the sort of, you said that 1 in 9 children don't know where their next meal comes from, or are food insecure. And food insecurity means you don't know where your next meal is coming from. And there's very few people probably on this this call or this webinar that actually have had to go through that, and it's a horrendous experience. And it's something that we've seen firsthand in Stop and Shop with our school pantry program, where we help. We have 50 pantries across our geography where we sort of help feed children as they take food home in the evening. And in Fall River, for example, we're helping feed 150 kids in 16 schools. And many of these kids are homeless, and they're going home to a home where there's nothing for them in the evening. And for me, I think, how can a child go to bed hungry and be expected to get up in the morning and go to school and concentrate and actually get out of that downward spiral that is part of this food insecurity in our society? And I think education is something that, if we don't get this sorted, then we condemn another generation to sort of poor education and for no fault of their own other than, food insecurity. And I think the second point that COVID has shown us is that the strong connection between hunger and chronic disease like high blood pressure, high heart disease, obesity, and diabetes. And we've seen that COVID attacks those conditions far more than others. And because of inequity in our society, that's hit some of the poorest and hardest hit communities. And again, it's something that we have to sort of focus on and move forward together to solve. And that's where the passion in Stop and Shop is focused on food inequity.
Well, thank you for that. We're going to continue to dig a little bit more in some of the issues that you just raised around infrastructure issues, supply and demand, the nonprofit sector being taxed, the access to food for young children and education. But let me follow up with you now, Prabal, as a senior leader at the Federal Reserve Bank of Boston. What do you see as the implications for our regional, national, and global economies that are posed by our current food insecurity challenges?
Thank you, Ms. Zamawa. I really appreciate the question. I want to say one of the things that's so important just about these sort of convenings is the cross-sector bringing together. And so when you think about the business case, which I hope to make, I really think that an organization like the Hunger to Help Collaboratory is exactly the right place to be making that case, to be moving upstream from the emergency food delivery space. And so I think what I would start is an argument that was made very well by Children's Health Watch and by other organizations, thinking about food as health and thinking about human capital. At the Federal Reserve, we think a lot about human capital, and certainly at this time of the workforce shortage, if you will, in many key areas, you have to think about the workforce of the future. And we know education is an input, right? We know that skills training is an input, but we also need to think about health and food as a critical input. And I don't have to tell this audience that the numerous ways in which food is important in terms of being able to do well in school and concentrate, and toxic stress amongst parents who don't know where either their or their child's next meal is coming from. But also, I think these health effects, the costs of all the various health conditions falling on children and on their parents, illnesses like diabetes, other illnesses that take kids to the emergency room. The same report by Children's Health Watch put this cost at $2.4 billion for Massachusetts in a single year. And so when you start to think about those kinds of numbers, and you think about just the share of health costs in our budget overall, like, this is important stuff to get right now, yes, but thinking about the future and the future workforce. So I think, I focused here a little bit, a lot actually, on children and families, but even those without children, need access to food. My wife teaches at Salem State University. They have a food bank there. Community colleges have food bank. And you can't go somewhere in the business community where people aren't talking about skills training and the skills mismatch and trying to train people. But the places that are doing this, like community colleges, like Salem State, the people there don't have enough food. The students are going to the food kitchens in a lot of cases. And so you have to think about how these things are connected to health, connected to economic participation through education. And I believe that thinking more holistically about the jobs and what a job provides and what employers can do. I know we have a question coming up on that, but I really want to highlight this sort of health-focused business case around human capital.
Thank you, Prabal. Really great points. And that leads me to you, Gordon, because making the connection with the business community workforce and thinking as a grocery retailer, what observations can you share about the changing landscape and increasing urgency around more equitable food access going forward and building on Prabal's point?
Sure, I think certainly we've seen as a grocery retailer, we've seen the impact of COVID firsthand in our stores and in the society as we've always supported food banks and we've seen the demand increase dramatically. I have the privilege of working on the board with Catherine on the Greater Boston Food Bank, and the change there has been phenomenal. But as you mentioned earlier, in a study in Massachusetts, food insecurity has risen by 55%. And I think just for me, just keeping it really simple is like, how do we get food to people? And how do we do that? And that's through work with food pantries or work with the food banks, and we support 13 food banks across our geography. But the demand has been enormous as we've moved into this last 18 months. And I think what's really important, again, as we move forward, I think too often we're just about meeting the need and meeting the need today. And I think there's a couple of things. One is I think we have to provide healthy food to people, and how do we go about that? And it's more important than ever when you talk about the related diseases through food insecurity, that we start to offer fresh produce. We make available proteins in people's diets to help them sort of through this time. And then for us, a lot of it was really about how do we help in our business reduce waste in the system. And we've introduced a program in this last few months with Feeding America, where last month our food donations to the Greater Boston Food Bank increased by 45% because of those processes we put in place. And also making SNAP and EBT available online to our customers, and we're the first grocery store in this area to make that available, so people can shop with their SNAP benefits online at stopandshop.com. And so there's a whole lot of work going on. There's a lot of good effort going into this, and I really do believe that what I've sort of seen in this last 18 months is the need for coordination, people working together and pulling together to solve this problem, because the food bank can't solve it on its own. Individual grocery stores can't solve it. We need the business community to step up and actually really sort of take this as a challenge, and a challenge to our society, to our economy, and to the future of the kids that we're responsible for.
Well, thank you for that. And thank you for the SNAP program. I've personally seen folks at the grocery store, at the Stop and Shop down the street here in Jamaica Plain, and it's very well used and very well received. Megan, I want to turn it over to you because you have a really interesting perspective in working with clients across the corporate space, and in hearing Gordon's comments and the work that they're doing as a grocery retailer. So given your experience with food and health access and all the equity work that you do, what are your thoughts on how to reduce health inequities that result from food insecurity, both regionally and nationally, and just thinking about all the work that you're currently doing?
That's a big question, but I'll take it on. No, I mean, as everyone said, it's an ecosystem, right? There's no silver bullet. But one analogy I would like to take is to healthcare, which is where I spend a lot of my time. We've always tried to improve access and improve healthcare. And the original thought was, okay, let's focus on the clinics or the hospital. What they quickly found is there's only so much you can do there, right? Because so much of the impact, as we just highlighted, is well beyond the walls of a hospital or any clinic. You need housing, you need transportation, you need access to good food, you need economic opportunities and resources. And so I would say the same thing is as we look at this problem of food insecurity, right? It's just not about providing food. That's absolutely important and a critical near-term need. But really, to solve this problem, we actually have to have the underlying mechanisms to enable people to support themselves as well. And so two big things that we have seen where there's opportunities to really drive is really thinking about the inclusive economy and how do we make sure, as you highlighted, right, there's disproportionate impact on certain populations. They have access to the economic opportunities. So for example, we as McKinsey have done partnerships with Feeding America to actually help on workforce development efforts in their communities so we can actually enable people to afford the food that they need to get out of food insecurity. Same thing, I would say, similarly just important, as I mentioned earlier, racial inequity, right? This is a systemic problem and it continues to be an underlying challenge as we think about food insecurity. And so it's really important that we invest in that as well. So we've been doing, city by city deep dives into really trying to help transform and address systemic racism and sort of all of the places that it is in the communities. And we believe those two things, inclusive economy and making racism and addressing systemic racism are really critical pieces as we try to hit at the underlying drivers, some of them for food insecurity.
Well, let me stay with you, Megan, and building on what you just said, and it's not business as usual anymore. That's just not going to cut it, right? Like we have to think creatively, innovatively. So are there any examples of innovation in this field that you can share with us that you think are promising, that can be able to build the evidence that we should scale up some initiatives that you think are innovative?
I think there's a variety of them. I think there's two. I think there's one which is sort of internal to the charitable food organizations, and I would say on the employer side. If we think on the charitable food organization, I think there has been some great movement to really modernize and transform, right? As I mentioned, right, these are very, nonprofit, volunteer-driven organizations, and they're very complex operational, as Catherine can speak to, right? And so really making investments there. And so if we can continue to support and provide, for example, business expertise, whether it's supply chain optimization, demand forecasting, these things can really make a difference in making these organizations sustainable. And from an employer perspective, I think one of the first steps is just actually understanding the level of food insecurity that you have. So we've worked with employers that actually asked this question and simply said, do you need, food? Do you need housing? Do you need childcare to just make to make things more sustainable? And what was the number one thing? Over 95% of the people this large employer did the survey wanted food. And they implemented a program where every other week they had a card that you could use for selective food. And they got glowing reviews from their employees saying, I feel like I can be healthy because now I can afford fresh produce and just make sure that there's food on the table. And it's a very simple measure, but very effective. And so just understanding and taking those simple actions can make a big difference beyond, in addition to what, Stop and Shop and others are doing into their community. There's a lot you can do for your employees as well.
Yeah, and that helps definitely with retention and employee productivity, and it's just a ripple effect as well. So along those lines, Gordon, and building on what Megan just said, what examples of progress can you see from your perspective that are allowing your world to increase more equitable food access?
I think I think these initiatives that bring or give access to healthy food to our customers and to across society is absolutely key to us. And I think there's elements where people can afford healthy foods come into the stores. I think there are areas for example, where there are food deserts where we need to sort of look at how do we actually service those areas or open stores in those areas as retailers. I think we've got a responsibility to deal with some of those issues. And that, I think, ties into the sort of food inequity and different economies. And I think, as I say, how do we actually make food available? How do we get access? During the COVID, we had a request from the city about some of the elderly and immunosuppressed citizens to how do they get access to food and how do they feel comfortable coming to a grocery store. So again, we set out hours where they could come in and shop without sort of feeling at risk. And across the whole of society, there's opportunities for us to help people access healthy food. And I say, I think load up our EBT program and SNAP online. We are doing some of this flash food app where we've done a trial in Worcester where people can go on the app and anything that's getting close to being out of date, people can come in and get it at a much sort of discounted price. And as I say, us supporting our food banks by reducing food waste in the business and working with the food bank to have that collected and made available to people as quickly as possible. And then also just financially as a business, through our customers supporting the food banks and the work that they are doing. And it really is this, I think, trying to pull everyone together to make this work. And we try incredibly hard to contribute. I would say we scrape the surface somewhat when you see the size of the problem, but we need everyone to step up, and that's hopefully what we're going to be discussing today and how we work together to make a difference.
Thank you for that, and we definitely need to step up. And speaking of stepping up, the Fed stepped up big time during COVID. So based on what Prabal, this question's for you. Based on what you and the Federal Reserve have learned from responding to the food and health emergencies created by COVID-19, what lessons can you share that continue to kind of build on what Megan and Gordon have already shared with us?
Yes. One of the things I really appreciate about what Megan said is that this isn't sort of giving food, that there's a whole system here that's interconnected. And one of the things the Fed did was really looking at the broader question of economic development, right? Because food connects to that. And found that those places that really had resurgent economic development had robust cross-sector leaders working together with vision and then measurement and accountability toward that vision. And so when I think about that applied to this area, to food and to food insecurity, I want to think about what's the role of the private sector there. And there's things that the private sector does phenomenally well. And when you think about measurement and accountability, that's something that the private sector absolutely can bring. Coordinating employment practices, supply chains, these are things that the private sector has to offer and to bring, and those efforts should be grown and expanded. And I think the Hunger to Health Collaborative, again, is that kind of collective impact style effort that can help do that. What I'd say is the private sector also has a role to play in terms of people's financial stability. And so there I do think about the quality of jobs, and particularly of low-wage jobs in a lot of sectors. We see, obviously, there's wage pressures now and labor shortage, and wages certainly have an important role to play. There are also other benefits as well. They may be around health or access to childcare or emergency savings, but what I'd say these things do is that they free up income to focus on other things. And I should say there is a principle that the individual, the family knows what's best, right, and knows what's best for their family and for their own circumstances. We can see from the child tax credit, right, which is a cash in a sense, it's a credit, that hunger goes down, that people use it for that, but they use it for, in the ways that they know best. In the case of the Chelsea Universal Basic Income experience, which the Shaw Foundation funded, what they found is that people used their funds in large part in local grocery stores, local supermarkets for food. And so I think it's just sort of a point here. The private sector has an important role to play, doing what it does best, but also recognizing where it is in the sort of importance of financial stability for people. And then the second is that people can make their judgments if you provide a system that can work for them and meets them where they are.
And that Chelsea initiative you mentioned, Prabal, can you just give our audience just a 2-second explanation of what that initiative is? Because it's a very innovative approach that has been done and is generating good impact and results.
This was an effort to provide a rather modest stipend, I think bi-weekly or monthly, to individuals in Chelsea, but also and it was done by a set of foundations, I think United Way, Shaw Foundation, others. But the idea was also to have individuals qualify for benefits that they already sort of qualified for, but maybe weren't accessing. And so have that support together along with the cash and with the supplement. And at least from what I understand, the early returns are that people are using these to support their families. We'll have to see the longer term studies of what the evaluations are. But providing cash, whether it's a child tax credit, whether the pandemic EBT was more around cash for food, but these efforts just provide more flexibility to families. Thinking about structural issues, though, you do have to again think about we had this problem before the pandemic, and the structure of low wage work. It definitely played a really big role.
Yeah. Well, thank you. Thank you for that clarification. So continuing our conversation, I want to shift our focus a little bit more on collaboration. We've already touched on it in different ways. But Megan, I'd like to continue with you and building on what Prabal said in terms of the business community doing what it does best. How do you see the increasing role of partnerships and multi-sector approaches to food and health challenges like the Hunger to Health Collaboratory offering a path to change, including working with the business community?
Absolutely. It's definitely the ecosystem. I think it depends, right, by each industry. And so Prabal mentioned this, but I think every company needs to think about what their strengths are and what value they can provide, right? So there's going to be some with logistical expertise that can help, on that side. There's going to be people that have access to food that can do that. There's some that, financing, right, and the access to actually getting these incentives. So I think it depends on sort of what you do, but I think the key is for every industry and every company to reflect and what they can do externally, but then also to my point earlier, to think about what they can do for their employees, right? Because if all large major employers actually address this, whether it be benefits directly, whether it's food benefits or just more living wage, we could make a really big difference. So I think the key is I'm really excited about this collaborative. It's got a good mix of different institutions, and I'm excited to see what everyone can come together. For example, Museum of Science, which is a non-traditional kind of, founding member, I'm on their board. It's really exciting to, so for them is about education, right? Because there's a lot of, lack of education on just nutrition and how you get access to that. And so I'm excited to see how all these different perspectives and organizations can work together to make a big dent in Massachusetts.
Yeah, and that's important too, because it might not be obvious to business communities or other organizations what role they can play, but there is definitely a role to play depending on who you are and where you come into that ecosystem and trying to be part of that solution. So Gordon, you're as the head of Stop and Shop, you initially had the foresight and imagination to be part of this solution, and you founded the Hunger to Health Collaboratory. Why do you feel this work is so important? I think it's been 2-3 years since the collaboratory was founded. So in reflection, why do you think this was so important then, and why is it so important now? And building on what you've said earlier.
Well, Zamawa, I'm old enough to remember Live Aid back in the 80s when we were going to feed the world and everything was going to be great, and we haven't really
Me too, Gordon. I can remember.
Haven't made as much progress as we thought we would, and I think for me, there's this realization that we can keep sort of providing food to people, but we've got to get to a stage when we get beyond just providing the meals that they're missing, or the food insecurity part, and really get to a point when we can end hunger. And how do we move forward from that? And it takes, I think everyone working together. It needs some of the best brains that we have to work together to say, how do we actually go about this, and what role can each of us play in making a difference? And we are a food business. We are, we've always supported the food banks all the way through our sort of history. But again, you just feel sometimes you're just sort of helping solve today's problem, maybe tomorrow's problem if you're lucky, but we're not getting to the point where it's going to really sort of change what's happening. And I really do believe, for the comments I made before about just getting kids, going to bed, with something in their stomach, where they get up in the morning, we can educate them, and they can listen, and they can actually improve their lives and get themselves out of this downward spiral. My grandparents, my grandfathers were both coal miners, and my uncles were all coal miners. And one of the big things they used to say was, like, education is the easiest thing in the world to carry around with you. And that's what they forced my brother and I to get to. And it makes a difference in a generation. And I really do believe that working together, we can actually get people in a better place. And if everyone gets on board and works together.
Definitely. We're getting quite a few questions from the audience. So I want to pause here and take some questions from the audience, and then come back and continue our conversation. And I think this question is, let me just look here. Okay, this question is for you, Gordon. It's our first question, and it says, and our participant is asking, the supply chain in the food industry has also been hit hard. So what are some of the solutions you see to meet the demand so that people get food? What can the ecosystem do to meet the demand?
The supply chain really is going into, I wouldn't say it's a crisis, but it's incredibly difficult, and there's a number of factors in the supply chain at the moment. One is, labor, one is transport, and it's just really difficult. Raw materials for products are difficult, and packaging are incredibly difficult. And a variety of our suppliers are facing some or all of those challenges. And we're really going to, the way people are talking, this is going to go into 2022 at least. So we're going to have to live with this. And I think our role is to make sure that we have product coming into our business. I think in terms of what we do in the short term to help the food insecurity, we'll keep doing what we're doing and keep supporting. We'll improve the waste reduction that we have. So all of those things we can keep working at. But I think there's a challenge in the moment where Yeah, supply chain, it's going to have tough times, but it's not going to impact food availability. So there are some real challenges. I was just going down a discussion that I had earlier today on the challenges that we have. But no, the food is going to be available. It's not going to be a problem. It's just you're not going to see 72 varieties of Barilla pasta on the shelf. You'll maybe see 10, and you won't see all your flavors that you like. You maybe see half of those, because people are starting to realize that our culture, we're so used to having an endless choice. And perhaps, I think resetting in COVID, maybe we realize we don't need 72 types of pasta. Maybe we only need, a handful that we look after, and how do we make that more effective and more productive? So I think I don't see it having impact in terms of the way we serve the food banks or support the food banks. And it's just going to be a challenge as we go forward, making sure we have product of choices that people can have in the store.
Megan or Prabal, do you want to comment on this question? All right. We have another question from the audience. What are the ways to get resources and help to immigrant families that are new to this state and can have language barriers that stop them from taking advantage of the help available to them? Who wants to take this one? Prabal? Want to start with you?
Yeah, so certainly things in multiple languages, right? So not just Spanish, but looking at the immigrant population and the languages coming in make a big difference. That it's an unfortunately politicized topic, and I think maybe less so in Massachusetts, but a lot of programs that sort of reduce the administrative burden and requirements, I think, have been used quite a bit. In California at one stage did support a form of payments for people, including undocumented in that. And I think that was a wise policy. I think that if you look at various ways in which programs are administered, are there ways to ensure that they're not barriers for the whole population to use them? I think that the other thing to think about, again, is this isn't just about emergency food delivery and supports right during the pandemic. It's about how the whole system works. Thinking about immigrants just from wherever they're from, we do have a labor need here. And how do we think about what people need to be productive members of our workforce and allow our businesses to grow where they're having trouble right now because they can't find available labor? Does that mean, we look at the workforce skills? Do we look at the credentials that people come here with, right? And think about new and innovative models to bring people in and train them for jobs at higher wages. Do you have a bilingual manufacturing floor? Do you think about practices that you have as an employer, ways to just ensure that people are able to provide the human capital that they have and unpack that? English as a second language courses as another investment.
Great. Well, thank you. So continuing, this next question, I think, is for you, Megan, and it's just kind of from your perspective and working with so many clients in the corporate sectors. Our attendee wants to know, what can employers do to find out if their employees lack access to meals and food? What kind of programs or initiatives do you think employers should be looking at?
Yeah, I mean, the first thing in terms of understanding the need is simply to ask, and just say that it is confidential, not necessarily anonymous, so that you can find that information out. And then I think a lot of it, as Prabal mentioned too, is that some of the most effective program is simply cash, which is, giving people on, a regular basis access to that. I mean, it was very interesting that, food insecurity was number one in terms of kind of the needs that people had, especially accelerating during COVID. So I think there's a lot of opportunities. And the one thing I would mention, in addition to what Prabal was saying in terms of how do we create access, is we also have to make sure that there's food deserts, right? So how do you actually get food to those communities, or how do you provide transportation so that they can get to the the access points? And so I just would want to add that as well, to think about that, because sometimes people don't think about transportation, for example, and the fact that they may not actually be able to get to the points of care where we are providing food is something to think about as well.
Well, actually, Megan, I'm going to stay with you because you just mentioned food deserts, and we do have a question from the audience. And the question is in terms of, are there any initiatives or what work is being done to address the issue of food deserts in Massachusetts? Is there anything that you can share with our audience, and anybody else on the panel, please feel free to jump in.
I'm guessing, Gordon, you'll probably be closest to that.
Gordon, want to take that?
Well, I mean, obviously with a history of Stop and Shop over 107 years, we have stores all over our marketplace, and we have stores in difficult areas and challenged areas, and we're committed to serving those communities. And we have initiatives that we're working through to say, how do we actually help those communities actually in a healthy way? You know, do we provide nutritionists and advice, and how do we work with the local communities there to actually sort of give a comprehensive sort of support to those communities? You know, we sort of work with the Dimmock Centre in Boston on a monthly basis, and we go and provide fresh produce every month to that in that community area. And I think it's a responsibility of all grocery stores to be looking at these areas and saying, well, how do we support them? And there are challenges, but I think that's something that we need to sort of step up and support. And as I say, I think then also we were really pushing hard to get this online ability for people to use their SNAP benefits there, because I think, again, it's something that really makes life easier for people. And we've been amazed at the uptake in that area and the use that has been made of it. So it's really, really encouraging.
Great, thank you for that. Prabal, the next question is for you. And our audience wants to know, as a representative of the Federal Reserve, how do you consider balance the potential unintended consequences of using monetary policy to assist with a health social issue like food insecurity?
Wonderful. So here's the good place to give my Fed disclaimer that these are my views and not those of all my views expressed today are my views and not those of the Boston Fed in that way. So the thing I'll say about monetary policy is to think about our mandate, our dual mandate. So one is stable prices, but the other is full employment. And I guess when I think about the changes the Fed has made to its monetary policy framework, right? It's a fancy term, but it's basically saying we really think full employment is as important as the other part of the dual mandate. Congress gave this to us. And if you think about that, you start to think about the decade plus where we've underrun on inflation, right? And missed our inflation target. And you think about, well, you know, could we have had a tighter labor market? Could more people have had jobs during that time? And I think in hearing from the community through a series of events, in addition to, you know, deep research, I think the Fed has determined through its monetary policy framework that you can, for periods of time on average, run an economy that has a tighter labor market. And if I think about racial and ethnic disparities, and I think about who benefits from that, it's not targeted, it benefits everyone. So just to be clear, you know, having a tight labor market benefits everyone. But I think that there has been thinking that the benefits to our country and what Congress has mandated to us come from having an economy where we do have a full employment and really hit on that full employment mandate and pay attention to that. So yes, I absolutely believe that helps with food security. And I think there's other benefits. There's a lot to take into account. I'm not a monetary economist, but just to say, when I hear about you know, employers sort of looking for ways to attract workforce and they're thinking about benefits or wages or other things, I think there's a lot of good in that. And I think people respond to that.
Anyone else want to comment on this, or we'll jump to the next question? All right. Well, Prabal, I think this one's also for you. To what extent can you reconcile expanding income through government policy and limiting its contribution to price inflation, which has been particularly acute in food markets?
So I don't want to come out over my monetary policy sort of pieces here. I guess what I would say is absolutely, you know, inflation, you can see the data on sort of temporary price increases. There's a discussion about, to what extent these are permanent or sort of one time, or how long they would last with some of the supply chain considerations. I'll leave this to monetary policy people to sort of determine, what's sort of a change in long run inflation. But I think, the thing is that from a human side, right, like, the price of food, the basics, right? Gas, these are the things that matter to us and matter to low and moderate income families. And so I think it's perfectly, appropriate to look at these prices and say, we're on a tight budget. What does this mean for me? How is this, sort of helpful? And I guess the question I would go to is my previous answer, which is when you do have a strong labor market, many of the groups that have had higher unemployment rates, lower rates of labor force participation, they're in the labor market. And so then you do have to sort of weigh these kind of overall benefits of having jobs and having wages sort of against that. And those are the trade-offs the monetary policy people are making. I would just maybe a quick sideline, Zamawa, you sort of shared your personal story here. So just in terms of hunger, like my child was adopted, and my youngest son was adopted. He came here at the age of 2. Like he was thin as a rail. I mean, just, and, malnutrition and all that. And here he is now, and he looks great. And I just have to say that, this is a personal sort of thing for me. He's going to pay your Social Security, right, when he's healthy and has a job and income, and he grew up hungry. So, this is times the country, right, for all of us. It's absolutely a business issue.
Well, thank you for sharing that, Prabal, and he's gorgeous. So I'm going to ask one final question as we're getting to our close, but I think this has been great, and unfortunately we didn't get to all the questions from the audience, but I tried to cover as many as I could. So just to close us out in terms of our last question, and you've talked about this already, but I just want to kind of drive it home for our audience. Can you touch on the importance of thinking beyond food as an emergency, to seeking and supporting more collaborative, sustainable solutions to promoting food access and health equity? And I want to start with you, Megan, if you can lead us in answering this question.
Yeah, I mean, I'll go back. I mean, as we said, right? I mean, food is, we've been challenged, and I think now is the time to learn from what we did, build a more robust ecosystem so that we're going to have a more resilient system in the future. And that is not just about food, but as we talked about, right? This is employment, this is increasing racial equity, transportation. The entire ecosystem needs to be improved so we can have more food security and just more happy and healthy people that, as Prabal said, will then continue to be, contribute to our workforce. I mean, I think the key thing is, right, it takes a village. And so we all need to do our part in order to make the difference.
Thank you, Prabal. What are your final thoughts?
Just want to underscore again, the importance of cross-sector collaboration. It's been shown by research to really bring about resurgence. So it's great to have all sectors involved.
Well, and Gordon, this is an event from the Chamber, and we have the business community, and would love to get your final words and what's your call to action for the business community.
Sure. The way I look at things is that we, as a business at Stop and Shop, we have assets that are available to use in helping change this. We've got over 400 stores. We've got 58,000 people. We operate with or work with some of the biggest suppliers in the world. We have a sort of supply chain with expertise and a whole lot of other expertise in the food industry. And, what are your assets that you have that you can bring to the table? And what I think that we're trying to do at Stop and Shop is make our assets available to the food banks, to other sort of areas to say, look, how can we use those to help? Is it fundraising? Is it getting their suppliers involved? How do we do it? And every business, whatever industry you're in, you have assets that can be used to fight this fight. And I think the challenge for us is how do we come together and use those assets, put them on the table and support each other and saying, right, this is where we're going. And I think the Congressman at the start said, we've got to have a plan to get this sort of sorted, and we need to work together to get a plan. And if we have a plan, this can be something that we really make a difference in. So that's all I would ask, it's time you come and join us, step up, use your assets to really help make a difference.
Well, thank you all for your insights and your wisdom. Clearly, as business leaders, we need to make food insecurity one of our priorities and step up, like Gordon said. So if we don't do it now, when are we going to do it? So with that, I'm going to turn it over to you, Jim.
Well, thank you, Zamawa, and thank you to all of our panelists, to Megan, Prabal, Gordon, for such a terrific conversation. It's great to hear all of your perspectives on such a critical issue as food insecurity, and not only the ways, but the why the business community can and should continue to lead on this issue, whether it is through ways of supporting the health of potential workers down the road, our current employees, financial support, our expertise. There's so many ways to step up. You've certainly given the business community some important things to consider within our organizations with respect to our employees' health and well-being. I particularly like the advice of asking your employees about issues that might be affecting them personally. We've talked a lot about issues of access to transportation, access to childcare, issues of mental health, all important. And I think all of our businesses need to understand what our employees are dealing with. But put food insecurity on that list. I think that the data that Megan provided certainly speaks to doing that. And if you want to know more about this, I am sure that if you reach out to Catherine D'Amato and the folks at the Greater Boston Food Bank, or learn more about the Hunger to Health Collaboratory, they both have great websites. I would encourage you to take this conversation and move it to action, whether it's contributions or just finding a way for your business to get engaged in the conversation. I said at the beginning that this is a unique type of topic for a business organization like the Greater Boston Chamber of Commerce, but I think that our panel did justice to the reasons why we chose to do it. We were joined today by two very prominent women in our business community that are Pinnacle Award winners. So I want to give a plug to our 2022 Pinnacle Award nomination program. Catherine D'Amato and Zamawa Arenas are among so many women in our community who are changing Greater Boston through their strategic vision, through their excellence and commitment, as demonstrated by the conversation today. We want to recognize more women who are leading in our business community in so many ways. So go to bostonchamber.com and nominate someone who is demonstrating that kind of leadership in our community. Once again, thank you all in the audience for joining us. Thank you to our panel, and thank you to the businesses and enterprises that have come together to form the Hunger to Health Collaboratory and make a difference in our community. Have a great weekend, everyone.